I'm Don Davies. I'm the Member of Parliament for Vancouver Kingsway and the NDP Federal Health Critic. Canadians cherish our public healthcare system. It's part of who we are as a people. It's also critical to our well-being. We know that when we're sick, our care does not depend on the size of our bank accounts or whether we have insurance. But our healthcare system is in crisis, serious crisis. Emergency rooms are overwhelmed, healthcare workers are burnt out, millions of Canadians lack access to a family doctor, and patients are facing massive backlogs for surgeries, diagnostics, and other procedures. And this is a national problem. This situation is being experienced in every part of Canada. There are many reasons for this, some decades long. But healthcare is shared jurisdiction, and that means that both the provincial and federal governments have a responsibility to fix it. When our healthcare system was created, it was based on a 50-50 cost-sharing partnership. However, over the years, the federal government's share has fallen far below this. While estimates vary between 22 and 32%, no one at any level disputes that basic reality that the federal share of spending is no longer equitable. The result is that successive Liberal and Conservative federal governments have shifted the burden of healthcare to the provinces and territories. When this is combined with an aging population that is living longer, technological advances and expensive treatments and pharmaceuticals, our system is nearing the breaking point. Because of this, Conservative premiers across Canada are using the current crisis as an excuse to privatize care. Alberta Premier Danielle Smith said that patients should fundraise for their health care. Manitoba Premier Heather Stefanson recently revealed privatization plans in her throne speech. And of course, recently Ontario Premier Doug Ford announced he's going to allow increased for-profit healthcare delivery. Rather than representing innovation, privatization will take our country back to the dark days before Tommy Douglas brought in public health care for all. Privatization will mean line skipping for the rich, a drain on workers from the public system, and longer wait times for everyone else. It will drive up costs in the short term as profits are added to the cost of healthcare delivery, and it will put our public system in a very vulnerable state long term. This is a frontal assault on our public healthcare system, and it must be stopped in its tracks. To date, Mr. Trudeau has refused to meet with the premiers until the outlines of a deal, in his words, are already in place, but that approach hasn't worked. We have been pressuring Prime Minister Trudeau to convene a First Ministers' Conference to forge an agreement to protect and build Canada's public healthcare system. It's welcome news today that he has finally agreed to meet. But it's not enough to just talk. Every day that action is delayed, the system deteriorates. Worse, patients suffer, and tragically in some cases, some die waiting for care. We need action, we need progress, and we need the right solutions. The federal government must be willing to come to the table with significant new funding that is stable and long-term. But equally, the provinces and territories must be willing to accept conditions and accountability measures. Above all, a basic rule for any increase in federal transfers is that public dollars must go to public care. And the federal government must make it crystal clear to the provinces and territories that any of them who violate the Canada Health Act will be met with immediate withholding of federal health transfer money. In the coming sitting of Parliament that begins next week, I and our New Democrat caucus will use every tool at our disposal to push the federal government for action on Canada's healthcare crisis. Through our confidence and supply agreement with the government, the NDP forced the Liberals to agree to additional, ongoing funding in the immediate future to address pressures on Canada's healthcare system. But they have yet to deliver. The upcoming budget is a perfect opportunity to become a health budget, one that not only reverses the slide in care, but invests in our public system for the future. It's time that the Liberals delivered the billion that they promised in 2021 and 2019, but they have yet to honor. By our count, this is over $21 billion in promises that the Liberals have made that they have yet to deliver a penny. Canadians deserve a healthcare system that is world-class, timely, and available for everyone. We know we can deliver it. New Democrats will continue to push hard for a new health accord that protects, strengthens, and builds our public healthcare system for everyone. Thank you, and I look forward to taking any questions that you may have.
So how optimistic you are for the upcoming meeting between the Prime Minister and the province in terms of closing any deals in that meeting?
Well, I'm 50-50. I'm cautiously optimistic because at least they're meeting, and that represents a breakthrough. Up to now, the Prime Minister has used the excuse that the provinces aren't agreeing to conditions as a reason not to meet, and we don't accept that. At the same time, the provinces who say they won't accept conditions, that's not acceptable either. So the fact that they're sitting down and talking is a positive step. On the other hand, we're far from a deal. And as Prime Minister Trudeau said this morning, they don't have a framework for a deal. All they're doing is they're agreeing to sit down and talk. And what I'm most concerned about is that attitude fails to recognize the urgency of the problem. You know, when we say crisis, sometimes politicians overuse that word, but I think it's a fair word to use in the current situation. And a crisis in healthcare means people suffer. So we can't afford to wait. So I want them to sit down, I want them to stay in a room, and I want them to continue to talk and meet until they walk out with a deal. But again, it can't just be any deal. It has to be the right deal. Because a healthcare accord that just gives money to the provinces, who then divert that money to private for-profit care, will not fix our problem. It'll make the problem worse.
Could you elaborate on, how going for the private sector will make the problem worse? Sounds like going for the private road is a quick fix, or at least lifting some pressure of the current scenario. But how does it make if that is a temporary measure, how would that be okay?
Well, a temporary measure that might help would be okay, but a temporary measure that makes the situation worse is not a smart public policy. It's like pouring gasoline on a fire. I guess you're taking action, but it's going to make the fire worse. It's the same thing here. If you put money into the private for-profit system, what happens is you take healthcare workers out of the public system into the private system. What does that do to the public system? It makes wait times longer. We know this because Saskatchewan and Alberta have done that. They've been experimenting with private MRI clinics for the last 3 years. Their wait times got longer. You may know that in the recent Cambie Surgeries case here in BC, that's very question of does it help to put more money into private system? This idea that if you take people that have money and allow them to buy quicker service, does that help the public system by taking them out, was tested. And 3-0, 3 Court of Appeal judges in a very long decision exhaustively outline the arguments, and they come to the conclusion based on the evidence that when you have a parallel private for-profit system, all it does is it provides faster access for the wealthy, and it hurts the public system. Here's something that I want people to think about. I don't think anybody is. What is the long-term impact of that? So let's say that we start creating more private operating rooms operated by companies, and you can pay for that. And more surgeries are done that way. What happens 20 years down the road? Those companies, when they come to the government and they say, here's the price for that, the government is going to be in a very vulnerable position. Because how do they say no? If they say no, they don't have the public system to do the surgeries. So you see, this is a very dangerous road to go down. Canada has had a very strong public healthcare system that has worked very well for many years. It's only been underfunded over decades. We used to have 7.5 hospital beds per 1,000 people. Today, 2.5. We're at 90 to 100% capacity in our hospitals at the best of times. When you have a pandemic like COVID or an emergency, our system gets overwhelmed. So you see, we need to put the investments back in the public system. I'm also told that we have capacity in the public system. We just need more investment in it. So we have operating rooms. We could do more surgeries. And by the way, I want to say this, that it is unacceptable that people are waiting. Patients shouldn't have to wait 6 months, 12 months, 18 months for a hip replacement or knee surgery. They should be able to get timely care. The question is how can we do that? And I say, if we're going to have more investment from the federal government should say to the provinces that money has to go into the public system, not to make private companies wealthier. And my final point is this: when you inject profit into the system, and private for-profit companies, they're not doing it for free. They want to make money. You are now adding an extra cost to the system. So I think it'll make it more expensive as well. So less efficient, more expensive, hurt our public system. That's the cost of privatization. Has to be stopped, and I'm calling on Prime Minister Trudeau to make sure that's a key part of the negotiations coming up.
Ontario and Alberta has already announced start getting the private sector involved in terms of getting the hip surgery or some knee surgery. Do you think this is? I understand your point just by the dangers of going to the private sector, but do you think it is some kind of inevitable road that we got to go in this situation?
The only thing inevitable are death and taxes. No, there's nothing inevitable about that. It's a choice. And again, it's a poor choice. No, it's not just me. This is not an ideological position where I'm basing this just based on my political philosophy. The evidence is overwhelming. It's clear. I mean, we have systems we can look at in the world. Look at the United States. They have a private system. What's the result? Tens of millions of Americans have no coverage. Their public system is not as good. So we shouldn't make that mistake. We can have a world-class system that is based on our public system. And right now our public system is in trouble. So I don't think you fix the public system that's in trouble by diverting money to a private system. It's as simple as that.
Mr. Davis, you touched on this a bit, but I just want to be more specific. You mentioned that there's no solid framework entering the negotiations on February 7th, but I'm just wondering, what do you and your party hope to see/hear during the meetings?
Well, I guess first of all, I'd like to know what the framework for these discussions are. I think the Prime Minister announced their meeting on February 7th, I believe, one day. We're going to need more than that. I think we need the Premiers and the Prime Minister to agree to a process, I would say over the next 90 days. So they should schedule a series of meetings that has the purpose to come out with a signed health accord. And again, the Prime Minister has been, I think surprisingly and somewhat disturbingly frank by admitting that there is no real plan here. It's just a decision that they're going to talk. So, I'd like to see a structure that is geared towards coming up with a deal, and we've done it before. There's been health accords negotiated several times in the past, and so we know how to do it. but it takes political will. And I want to say that both sides are right in a way. I support Prime Minister Trudeau in his call that any additional healthcare money must be tied to certain conditions. For instance, I think it's reasonable to say that healthcare money should be broadly spent for healthcare. Provinces and territories should agree to that. I also agree there should be some basic accountability measures. So when the provinces get more money, they should agree that they report back to the federal government, at least broadly, how successful that money is. It's also important to share data because provinces are going to be doing different things. Some provinces might build more medical schools and nursing schools like BC is doing. Others may put more money into mental health. Others may pursue team-based care. There's a variety of things that are good to do. So we should share that information. And that's why the data sharing is an important part of this. But the provinces are also right. The federal government needs to come to the table with more money. As I said in my figures, whether it's 22 or 32%, it ain't 50%. Even the federal government, when they say they're paying more, the provinces are not taking into account the tax points that have been transferred to the provinces. It's not 22%, it's higher. Even they admit that it's still 32%. So 22, 32, it's not 50. And so we need both levels of government to be a partnership and to work together. And that means a 50-50 partnership in funding, and it means working together. And I think that's the breakthrough that I'm expecting to see, I want to see, starting next month in February.
And on that note, we've been talking about this negotiation between the federal government and the provincial government. I'm just curious, how do these negotiations affect your relationship and your agreement with the Liberal Party?
Well, that's an excellent question. I mean, there were 4 healthcare provisions in the Confidence and Supply Agreement. One on dental care, one on pharmacare, one on long-term care, and one that compelled the Liberals to recognize the crisis in our system, and they agreed that they would provide ongoing, immediate funding. Now, the ongoing is important because what I've heard from the premiers, and from health ministers like my colleague Adrian Dix, who's doing such a great job here in BC, is you can't just give them one-time funding. You can't build a system on one-time funding. They need stable long-term funding. And so with us and the Liberals, we are going to force the Liberals, starting next week in Parliament, to deliver on their promise in the Confidence and Supply Agreement. And if they don't do it, Jagmeet Singh has been quite clear. We're prepared to walk away from our agreement if they don't do this. I have a piece of paper here just from 2021. This is what the Liberals promised they would do. $3.2 billion for 7,500 new family doctors, nurses, and nurse practitioners. $6 billion one-time top-up to the Canada Health Transfer for backlogs of surgeries. They've only delivered $2 billion of the $6 billion. $4.5 billion for a Canada Mental Health Transfer. $6.8 billion for safer long-term care. $1.7 billion to ensure personal support workers are paid $25 an hour, and there was more money for training. You total all that up, and $21 billion in promises just 14 months ago, unspent. So it's our job to go into Parliament as the NDP and make the Liberals put that money into this year's budget, and also to fix the long-term funding that they promised in our Confidence and Supply Agreement. So that's the 2 goals that we have with the Liberals, and we take this very seriously. If they don't fix our healthcare system, come the end of this year, we'll have a serious discussion with them about our ongoing support.
So with the current situation, how likely do you think the NDP will walk away from the agreement with the Liberals?
Well, that's impossible to say at this point. I mean, I will say this, 2023 is a historic year, I think, in Canadian politics. Because it's unusual to see an agreement between 2 parties that are working together. And we have 27 different things in our Confidence and Supply Agreement that are positive for Canadians. For instance, I've been working on dental care. I'm very excited and hopeful that by the end of this year, we will have free dental care for seniors over 65 children under 18 and people living with disabilities who make under $90,000 a year and don't have that coverage. That's, you know, that's probably about 5 to 7 million Canadians. So I'm optimistic that by working together we can deliver these for Canadians. But as we said, a lot depends on the Liberals. They have a history of not keeping their promises. So it's our job to hold them to their word, to pressure them and push them. And you know, I'm going to cross my fingers and hope that we can get done. Not for us. It's not for the Liberals or the NDP. This is because these are great policies for Canadians. Patients need it. I'll conclude by saying Canadians' public healthcare system is one of the things we're most proud of as a people. You know, we boast about it to the world. It's something that binds us together as a nation. When they do polls, people say that this is one of the things that unites us as Canadians. So when we can see it's in crisis, and who denies that? You know, who is standing up saying, oh, there's no problem? There's a serious problem. Doctors say it, nurses say it, healthcare workers say it, patients say it. I have never in my life seen trailers parked out of emergency rooms. I've never in my life seen emergency rooms closed for lack of staff. So we have a duty as parliamentarians to address this crisis and to solve it. And that's, I think, what the NDP, we're the party of healthcare. We invented it in Saskatchewan in the 40s. We made it happen in the 1960s, and it's our job to make it even better in the 21st century. So I'm optimistic, and as Jack Layton used to say, don't let them tell you it can't be done. Anything further? Thank you. I really appreciate your time. Thank you so much for coming out today.
Thank you.
Thanks.